Mark Collins is a 36-year-old Burmese male who is here today with a complaint of reported left ear fullness and pain. He is otherwise a healthy individual. The pain and aching began 2 days ago with no reported triggering event, but does report starting swim lessons at his local YMCA about 2 weeks ago. Pain has been consistent, slightly improved with 650 milligrams of Tylenol 2 to 3 times a day, and worsening at night when he lays down to go to sleep. He reports the pain is about a 3 to 4 on the severity scale. It is limited to his left ear. It does not radiate anywhere else. He denies any associated symptoms, and he reports that he has felt similar fullness in his ear in the past when he's had cerumen removed in the clinic, and reports that it is affecting his ability to sleep at night. He denies any fever, chills, tinnitus, any dizziness, nasal drainage, vision changes, any dyspnea, or throat pain. He denies any current or past issue with upper respiratory infections, any treatment for strep, any chronic rhinitis, sinusitis. He also denies any familial history with skin issues, hearing loss, kidney disease, or any history of Meniere's disease. He reports being up to date on his vaccinations and no recent history of trauma to the head or body. He denies smoking and no current substance use. On physical examination, he is he appears in no acute distress, and his vital signs were stable. His left ear, on examination of his left ear, his left tragus is tender to palpation, and his internal canal was edematous and erythematous. His tympanic membranes bilaterally were pearly gray. There were no sign of perforation. The cone of light was present. Bony landmarks were distinguishable. No sign of effusion or drainage or swelling. The rest of his examination was unremarkable. His lung fields were clear to auscultation. So in terms of diagnosis, my working diagnosis is acute external media, acute otitis externa, versus bacterial versus fungal, and versus contact dermatitis, with my CAM being necrotizing or malignant externa media, and versus less likely psoriasis versus eczema. So for my plan, I would do some cleansing here in the clinic of the ear, and then prescribe a neomycin otic drops for the patient to return home with to start using today, and then instruct the patient on abstaining from swimming for the next 7 to 10 days, and then instruct the patient on when to return to the clinic, or to seek medical care in terms of fever, chills, further sensitivity of the ear, increased pain, and lack of improvement in signs and symptoms. And that completes my my clinical presentation.